Thank you all for joining us for Albany County Executive Daniel P. McCoy's 2022 State of the County Address. The last time I had the honor to introduce County Executive McCoy, we were in a much different place. A year into the ongoing COVID-19 pandemic had left us afraid for our well-being and the health of our loved ones, exhausted by waves of infections and isolation, and in many ways uncertain about our future. And that was even before the Delta and Omicron variants would ravage our community. For that reason, we continue to look to the county executive to chart the way through the darkness at the helm of the ship, to give us hope where at times it may have seemed hopeless. And as his deputy county executive and right hand, I couldn't be more proud of his steady, calm, but determined leadership throughout this crisis that left Albany County residents feeling more at ease, that saved lives, that upheld quality of life to the extent possible, and ultimately brought us to where we are today. It is amazing how so much can change in just 1 year, and how the worst days can feel like a bad dream. I have seen what many of you have seen throughout the last year, the county executive's unwavering devotion to protecting the people he serves and improving the lives for future generations. But it is a new day. The pandemic is certainly not over. But with this virus now under control, we are able to turn the page on those dark days to a new chapter that awaits us. We must remember that there is still so much work ahead of us to rebuild, recover and grow beyond what we've known before to make Albany County more prosperous than ever. And just as we look to County Executive McCoy for his leadership throughout the public health crisis, we now look to his leadership for the many challenges that everyday Albany County residents still face. And what the county executive will present in his State of a County address is a blueprint to solve these issues, new policies that keep moving us forward, and forward-thinking initiatives that continue to bring hope and inspire us. And while we are indebted to the county executive for his service as leader of Albany County, through the good and the bad, he would no doubt say we couldn't do this without our partners in government and throughout the community. I would be remiss if I didn't recognize some of them tonight. I would like to extend a sincere note of gratitude to those fighting for Albany County's fair share in Washington. United States Senate Majority Leader Chuck Schumer, United States Senator Kirsten Gillibrand, and Congressman Paul Tonko. I want to recognize our new governor, Kathy Hochul, who in a short period of time has already proven her mettle and earned another 4 years as New York's first female governor. I would also like to thank those who represent us in the New York State Capitol. State Senator Neil Breslin, State Senator Michelle Hinchey, Assembly Members Pat Fahey, John McDonald, and Phil Steck. And of course, all of our great local leaders, the city and village mayors, the town supervisors, and our fellow leaders in county government. Chairman Andrew Joyce, Majority Leader Dennis Feeney, Minority Leader Frank Moriello, and all of our county legislators, as well as County Clerk Bruce Hidley, County Comptroller Sue Rizzo, our Sheriff Craig Apple, and District Attorney David Soares. Each of you working with County Executive McCoy's office have helped us get back to where we are today, bringing us back from the brink. And I can honestly say with great confidence that each of you deserve the right to look back on what we accomplished, the unthinkable obstacles that through which we persevered with tremendous pride. When COVID-19 first found its way to Albany County, it was inspiring how the community, people from all walks of life, came together as one to lift up those that were struggling, the sick, the unemployed, the isolated and afraid. We were able to do that not as Democrats or Republicans, conservatives or liberals, not divided as urban, suburban, or rural residents, but as a united Albany County. And just as we came together for that important cause, let us maintain that sense of unity to build on this progress for the cause that lies ahead. And with that, it is now my distinct pleasure to introduce our great county executive, Daniel P. McCoy.
So, good evening. I'm going to start a little bit different tonight than I usually have in the last 10 years of giving the State of the County address. As we all know, we just ended a 20-year war in Iraq and Afghanistan, And now we have President Putin from Russia going into Ukraine. And life has changed coming from COVID-19. But my prayers and thought go with the people of Ukraine. War is not the answer, peace is the answer, and hopefully they can resolve this without Russia continuing to advance on a country unprovoked. Thank you for watching remotely my 11th annual State of the County Address. Last year, I delivered the State of the County Address remotely, as I'm doing now. However, we're in a far different place today than we were 12 months ago. As I sit here before you, know that the ship is steady, the course is certain, and the strength of our county is strong. Today, I will provide an update on the various programs and achievements over the past year and outline a tremendous path upon which we have already embarked. During the health crisis, we were forced to focus on right now to respond to the deadly COVID virus. We needed all hands on deck to learn, to shift, to pivot, and to redirect resources as we needed to combat this global health crisis and save lives. A year ago, we had hope that the vaccine represented the light at the end of this dark COVID tunnel. It has taken longer than we anticipated, and tragically, during this time, we have lost over 500 Albany County citizens to COVID-19. These are our mothers, our fathers, our sons and daughters, our neighbors, and our frontline workers. My thoughts and prayers go out to the families and loved ones of all those who have passed. Please let us take a moment of silence to remember them all. Over the last year, we've worked hard with so many partners to get the shots in the arms of every citizen, regardless of race, age, or economic status. We know that the vaccine saves lives and is the best weapon in the arsenal for our battle against this deadly virus. We called upon the 900 plus members of the Albany County Medical Reserve Corps to administer shots inside our arenas. We partnered to schedule vaccine appointments and outreach to communities with the Alliance for Better Health. These partners were instrumental in establishing an online pre-registration system for vaccines, which helped over 45,000 county residents get pre-registered on the site. These partnerships also assisted our efforts in outreach to minority communities to provide equal, if not greater access of vaccine to disadvantaged neighborhoods. We did this by creating 50 pop-up clinics that brought vaccine directly to neighborhoods where people live, work, worship, and go to school. In total, nearly 10,000 vaccines were administered at these sites. Our Department of Health performed and continued to perform extraordinarily in efforts to get our vaccine and to keep our citizens healthy and safe. In 2021, our DOH operated 320 pods, coordinated over 80,000 doses of vaccine by administering over 48,000 and reallocating nearly 32,000 to community partners. Our Department of Health partnered with local schools to provide over 2,000 doses of vaccine to our children and also to distribute nearly 40,000 tests en masse for our students and teachers. It's important to note that all this COVID response work was being performed simultaneously as normal operations of the health department, and we continue to offer COVID vaccine doses and booster shots daily at our health department. While we were making valiant efforts at vaccinating our entire population, there were challenges and barriers. Throughout many minority communities, we saw disparities. We also saw cultural and generational mistrust of government. In response, we created a public service announcement campaign through many forms of media, including television, network stations. We engaged local leaders, members of the clergy, culture organizations, and community-based nonprofit organizations to get out the facts, to displace disinformation, to promote vaccination, and to provide access. We set up smaller pods within communities and partnerships with the neighborhood churches. We set up pods at senior housing apartments and public housing units. We also worked with our partners, Mohawk Ambulance and Sheriff Apple, to reach homebound residents. Our Department for Aging was very active in the vaccine effort by partnering with Rite Aid Pharmacy to set up pods at Beth Emeth, which resulted in vaccination of 2,000 seniors. We have accomplished a great deal to date. Nearly 90% of our 18-plus population has rolled up their sleeves for the vaccine. I thank each and every county employee and volunteer who helped in this effort. As county executive and leader of government, I have pledged my commitment to be a strong and steady hand at the helm as we forge new paths. My vision is for inclusiveness, to break down barriers, and to dedicate resources to making equity in health and wellness for all citizens a reality, not just a catchphrase. It is a vision that recognizes the changing landscape of our industry and commitment to economic development plan that spurs job growth, fosters partnerships with labor, and development opportunities for training and education to members of our historic disadvantaged communities. And a vision that sets us on the path to ensure that we severely decrease our carbon footprint by implementing policies that remove reliance on fossil fuels, including a commitment to a passenger vehicle fleet that is 100% electric within the next 5 years. Tonight, I ask all of you to join me in this commitment as we blaze a new trail, one that is full of light, full of hope, and full of endless opportunities. As our great President Barack Obama said, change will not come if we wait from some other person or if we wait for some other time. We are the ones we've been waiting for. We are the change we seek. One of our biggest highlights is a new partnership has resulted in the newly named MVP Arena. The naming rights agreement with MVP Healthcare began at the beginning of this year. We've held an open bidding process in which I made it absolute necessity that all vendors understand that we are seeking a true partner with Albany County in their arena. And not just a company put their name on a building. We had an opportunity to do more. We needed a sincere commitment from a partner in the community. And indeed, we found one in MVP Healthcare. I would like to thank Chris Delvecchio and his team, the MVP Board of Directors, for their commitment to Albany County. In addition to the annual naming right fee, there is an annual innovation fund commitment. Through the lifetime of the agreement, which extension, this means $21 million in funds to promote and support ideas and programs that assist Albany County in our commitment to breaking down barriers, creating a healthier community, and providing education, training, and wellness programs for our youth, our seniors, and our residents as a whole. I also look forward to using the MVP Arena to jumpstart economic development and to bridge the downtown neighborhoods with the South End neighborhoods. This year, through our partnership with MVP and ASM Management, we will begin hosting farmers markets to provide fresh food opportunities to the community, as well as hosting job fairs, workforce development groups that break down barriers and create opportunities, particularly for those living in historically disadvantaged neighborhoods. This time now to make these changes. Be bold, build partnerships, and truly make a difference in the lives of our young, the lives of our aging, and the lives of everyone in our community who needs us. And again, thank you, MVP Healthcare. We know differences and disparities exist in our healthcare systems, and we must break down barriers and remove stereotypes to allow for true health equity and provide necessary health and wellness services to all our citizens. Everyone needs access to healthcare, and the healthcare that is accessed needs to be equal. Further, we must do a better job with our education of our communities in health and wellness for the young and aging alike. And then we must also ensure that our citizens have the means. A person can be given access and then they can be imparted knowledge. But if the tangible item or service is beyond their financial needs, then we have provided nothing. Living healthy is a God-given right, and making sure we have access to maintain good health should not be determined by the size of a person's bank account. But we know equal access doesn't exist, not just here, but throughout our country. Those communities with higher rate of poverty receive less preventive health care, have obstacles in getting to the doctors and dentists, have higher out-of-pocket costs for health care, and do not have access to or the means to pay for healthier food, for healthier meals. The result of this leads to higher rate of disease and shorter life expectancy and higher rates of infant mortality. Children with poorer families are also at significant higher risk for asthma and obesity. With COVID-19 came a lightning bolt, an opportunity for a reboot. As I said earlier, the time is now to forge a new path. We must capitalize on this once-in-a-century opportunity to turn things around, break down barriers, and truly create a county where health equity is a reality. This is why I directed all departments to make health and the wellness of our community a priority. As we develop policies and procedures, as we create new recreation opportunities, as we deliver services, we must keep a keen eye on our current disparities and make health and wellness, equity, a primary factor in our decisions. As I report on various departments, you will notice the common theme being applied throughout our programs and services. COVID not only caused a crisis for our physical health, but also pushed us into a mental health crisis, including a drug overdose epidemic within a pandemic. One of my first acts when COVID hit was to set up a mental health crisis hotline for individuals struggling with disparities and behavior issues. People were forced to isolate. It became forbidden for children to play together. Physical activity and team sports were impermissible. Stores were shuttered, industries ceased to exist, and jobs were lost. Daycare centers became a constant turnstile of quarantined children. The toll of this became too much for the people, resulting in a rise by teenage girls and suicide attempts. Indeed, the detrimental effects of COVID-19 on our mental health is a reality, and the length and lasting effects remain unknown. What is known is that we need to do more for the mental health and well-being of our community as a whole. Again, we need to turn things around, all of us. We can continue along and provide a way to jump hurdles. We must permanently remove all obstacles to receive mental health services. This starts culturally. We must remove any and all stigma and negative connections. Asking for help should not be considered a sign of weakness, but a sign of strength. This is not a decision or action of government or healthcare providers, but rather must be a concerted and collective effort of all citizens come together and accept opening eyes, opening in our hearts and the opening of our minds to recognize the status of affairs around us each day and commit to healing our neighbors and loved ones through all means. As I said earlier, be brave and engage. We need early engagement and prevention strategies. Mental health services should not be limited to reactionary response to behavior issues. We teach our kids about physical fitness. We teach our kids about physical health. But we do not provide the same level of education about behavioral issues. People get annual physicals, but not for their mental health, even though the need for assessment is just as great. Why is this? Limited access to providers, negative stereotypes, culture inequalities. We need to do more, and we will. I'm directing the Commissioner of the Department of Mental Health, Dr. G. O'Donnell, along with the Commissioner of Children, Youth, and Family, Maura Manning, to lead a task force with community leaders, stakeholders, educational institutions, to devise a comprehensive plan, together with a roadmap for implementation of the plan with specific matrix that use data analytics to track the success and provide specific changes depending upon the continued analysis and tracking patterns. We also have a crisis within a limited amount of professionals in the industry to provide mental health services for both preventive and remedial care. I'm encouraged by the announcement from Governor Hochul in her State of the State address that provided funding to promote and educate people to enter healthcare industry. My hope is that this program includes behavior sciences or expands into incorporate behavior science. Through the past year, over mental health department engaged in many programs and provided services to thousands of residents. In 2021, our mental health court opened. This unique diversion program was 5 years in the making and addressed a long history of people with mental health issues being processed through our criminal justice system. Instead of finding solutions through treatment and support services, the new approach will address the underlying behavior issues and severely reduce the risk of recidivism while allowing for the person to reconnect with and continue to be positively engaged with society. These successes of this endeavor is due to the partnership with our Department of Mental Health, New York State Office of Court Administration, and the Public Defender's Office, the District Attorney's Office, and Probation Department, Albany City Court Judge John Riley. Congratulations to all those involved. In the past year, we launched our Accord program. This is a collaboration effort with the county legislature and the Sheriff's Office to provide alternative crisis response in our Hilltown. Albany County crisis officials responding and diverting our Accord pairs social workers from our mobile crisis team with paramedics from the Sheriff's Department and EMS division to respond to nonviolent situations where law enforcement presence is not required. The key point to the program is having trained mental health and medical professionals respond to calls involving non-violent individuals experiencing a mental health crisis. Historically, it would be police responding. However, the need is not law enforcement, the need is clinical. This program diffuses and de-escalates situations and pairs the right people together while preserving public safety resources that allow officers to be available to respond to police matters. As a result of the success of this pilot program, we are now expanding it to other communities. Those two programs are a prime example of how we are changing, adapting, and shifting resources to address the changes of mental health. In addition to 2021, our Department of Mental Health responded to 1,002 crisis calls and assisted with 513 hospital diversions through our mobile crisis team. Our COVID mental health support line, which I launched in the first few weeks of the pandemic to help deal with isolated related anxiety and depression, and answered 475 phone calls between March 2020 to July 2021. Additionally, our mental health team conducted 2008 visits for integrated mental health and substance use disorders, which is up from the 1,972 individuals we served in 2020. In 2021 alone, over 7,000 individuals received some kind of service provided by the Department of Mental Health through over 40,600 separate interactions with residents of Albany County. I sincerely applaud the efforts of Dr. G and the entire team dedicated of employees that provided such needed care to our residents. Now I'd like to turn our attention to our nursing home, Shaker Place Rehabilitation and Nursing Center. Our new nursing home opened 2 years ago and is ranked by the Newsweek as one of the best nursing homes in New York State and has received a 5-star rating from the Centers for Medicare and Medicaid Services. During the healthcare crisis, our staff came into work every day, provided extraordinary care for our residents and to keep them safe. In 2021, there were no COVID deaths among the 400 residents we cared for and only one positive case all year. This is truly a remarkable feat and testament to the vigilance and dedication of our director, Larry Slacky, and the entire team of professional men and women who serve our residents. As I referenced earlier, there is a sincere shortage of healthcare professionals in the capital region, through New York State and across this country. Regardless of pay offered, there just aren't enough men and women in the field compared to the need for the amount of patients and residents we have in the hospitals, the rehabilitation center, and the nursing home. We have an amazing new facility and a great staff that provide first-class service. In order to maintain this level of care to our residents that deserve a life in dignity, we must continually use all efforts to recruit and retain a high-quality workforce. To do so, we must be creative in our offering of benefits. Child care issues exist for many workers. Assisting our workers in alleviating this concern can truly be a game changer to keep and attract talented individuals. I'm pleased to announce that we have partnered with the Colony Youth Center to construct a daycare center at our own nursing home campus on the first floor of the tower building. We have engaged the engineering and architect firm for design, and we expect to have a grand opening in the beginning of next year. This new state-of-the-art daycare center will be operational and expanded over time to provide daycare services for nursing home employees that work all different shifts. Further, county employees shall be offered daycare participation after the nursing home worker population need has been fulfilled. Providing this access to the work location will be a big plus. It will allow for parents to visit their children during a break. But more is needed. Oftentimes, traditional daycare centers are too costly, and a person has to choose between working and staying at home. To address this sincere issue, I'm announcing that we shall be offering an affordable payment schedule for our employees. This sliding scale shall have a rate, and then the rate is reduced accordingly based upon the employee's household income. Women and men should not have to choose between having a career and caring for their child. Now let me mention a few other of our departments and the accomplishments over the past year. In 2022, our Department for Aging is moving to the newly renovated tower space at Shaker Place Rehabilitation and Nursing Center, and we announced the campus for creative aging. This initiative will serve as a senior center without walls, offering programs and services throughout the county. They will connect seniors with arts, education, wellness, and a new restaurant program. The return of the doctor is in and more. The department move will allow for increased collaboration with nursing home staff during the COVID crisis. The need to help victims of crime or sexual violence was greater than ever. Children were not in school where they could talk to teachers and be seen by those trained in identifying potential abuse and tensions in the home, because the pandemic created unimaginable situations. The department responded in kind by reaching out to as many as possible through various media outlets, as well as telehealth counseling. I also sensed the need for a better place for victims to come to than the county building at 112 State Street. Accordingly, I directed our Department of General Services to rehabilitate a property so that our crime victims, advocates would be able to have a comfortable and private setting to converse and interview those that are most vulnerable. This private location has been fully renovated and is currently in use by our staff members. When I became county executive in 2012, I made it a priority to polish one of the Albany County's tarnished jewels, Lawson's Lake. Over the last 10 years, in partnership with Sheriff Apple, it has become a haven for kids and adults alike to enjoy year-round. Renovation of the Wilden Lodge, creation of a true visitor center, the building of an amphitheater and a pavilion, so much more have attracted groups like the Boys and Girls Club to return for camp each summer. This past year, we expanded our partnership with CDTA to offer day camp to children in the town of Queens. There's so much more untapped potential at Lawson's Lake, and this is why there's a comprehensive plan underway to evaluate the site so we may determine the best way to use this beautiful space and create even more access for all people to enjoy. Residents throughout the Capital Region have been getting out to breathe the fresh air and exercise on the Albany County Helderberg-Hudson Rail Trail. For the second year, we feature food trucks along the trail, providing local small businesses another opportunity to generate revenue and expand their clients. Nearly 200,000 people use the rail trail each year, and we shall continue to find ways to expand and complement the use for all families. One such way is through our partnership with MVP Healthcare. We should be adding special fitness equipment and a court adjacent to the trail near the Singerlands trailhead. We added another annual event, Chalk the Walk contest. In the partnership with Mohawk Hudson Land Conservation and the Art on the Rail Trail, working with these organizations, the county had an artist develop new murals on the surface of the rail trail itself that promoted safety and cooperation among the visitors by beautifying the space, dubbed Share the Trail. The rail trail, another one of our county gems. As I stated earlier, providing health and wellness equity is a priority, and the Department of Recreation is vital to carrying out our mission. Through the youth programs throughout our many communities, like basketball, flag football, and karate, our children get exercise, but much more, they also learn life lessons of teamwork and discipline. And while these efforts of the department are primarily, we need to do more to expand opportunities beyond traditional sports. There are so many boys and girls who have no interest and will never have interest in traditional team sports. However, programs still need to be offered. We must expand into esports programming, expand out curriculum to include STEM programming that intersects with our natural resources and expands into theater, music, and art in our outdoor settings. As I stated earlier, we need to be bold for health and wellness of everyone. We must be inclusive. As these programs expand, it is paramount that access to them is not limited by zip code or a parent's ability to provide a ride. All barriers must be brought down, and we must find partners to bring these wellness opportunities to everyone. Learning from mistakes will help us prepare for a brighter future. Our county probation department is offering the first of a kind program that will help those who have gotten into trouble and send them and get the schooling necessary for a high school diploma equivalency. This will allow them to find jobs and for some, get into college, to get a degree, to find reliable income and leave crime in the rearview mirror. We've partnered with Capital Region BOCES and the Capital District Educational Opportunity Center. Currently, 24% of those in our probation department system do not have a high school diploma, and studies have shown that median annual earnings increase by an estimate $8,000 after you get a high school diploma. Having a better paying job is a good step toward that end. The greatest resource that we have is our people. The people that make up our workforce are thoughtful, committed, and dedicated, but much has been changing over the past 2 years. After the stopping time, many people are coming out of the pandemic with a different view of work and profession. With a learned understanding of remote work and a deeper appreciation of work-life balance, millions of America left their job. In fact, over 38 million Americans quit in 2021. For the first time in generations, the market has flipped. The demand for qualified workers is more prevalent than those seeking the position. With this environment occurring, at my direction, the Commissioner of Human Resources, the Director of Civil Service, were tasked with creating a comprehensive workforce development plan for Albany County. This required these commissioners to meet with all departments to get a better understanding of short-term and long-term goals, as well as conducting a deeper dive into interdepartmental working and sharing of responsibilities to break down silos and work collaboratively as a single employer. The review also included all titles and job descriptions to consider whether some became obsolete and whether the current or future needs requirement newly created titles. The timing of this was paramount, as we had just shrunk the workforce by implementing the Early Separation Payout, ESP, program that eliminated nearly 80 positions, saving the county $4 million in 2021. In our review, we need to give careful attention to recruitment and career progression, while at the same time recognizing the need for efficiency and effectiveness delivering of services. We need this comprehensive workforce development plan to have a deeper understanding of our operations, our work culture, and our compensation benefits, and mobility of the individuals, including upward and horizontal growth within the entire organization, not just as a department. As a result of this effort, we took and continue to take strategic steps to enhance our ability to retain, recruit the best and brightest individuals to join our team. This year, we implemented a change in our longevity pay schedule. This is the first revision in over 30 years. Indeed, long overdue. There are also adjustments made to key positions to retain staff that had distinct and abundant knowledge and experience, a necessary measure to be competitive with similar suited counties, as well as state employees in our backyard. In review of our health plan, it was realized that the hearing, dental, and vision benefits currently offered should be increased. Providing better dental coverage reduces emergency room costs, leads to better oral health outcomes, and lower future medical care costs. Similar cost savings are seen with adding hearing and vision benefits. This is a win-win situation, better benefits for employees, and future medical savings to you, Albany County, and the taxpayers. This year, we also increased our budget for training. While we're always recruiting new talent, it's vital that we provide our current employees with opportunities for personal and professional growth. This growth is not limited to a department, but should be horizontal with opportunities throughout the county as a whole. The plan also includes suggestions for creating a data position within departments. Capturing data helps us track employee satisfaction, as well as production and performance. Being happy becomes a factor in people selecting a workplace and staying. A point shows in this past year with 38 million people quitting. This requires us to take serious steps to improve and maintain the culture of our workplace. We're an innovative employer that prides itself on environmental sustainability, commitment, engagement, and creative policies and programming. We are an employer that recognizes and understands the importance of work-life balance. And we are an employer that seeks the brightest to help us shape the future of our communities. Our people, our employees, they are the driving force and the key to success. We are very fortunate to have such a talented and diverse workforce that performs at excellent levels throughout the pandemic to deliver necessary services to our residents. I sincerely thank all of you. During the COVID crisis, we learned to work remotely. We learned that a hybrid model, and we also learned that we could deliver services with smaller workforce. This led to the question of whether we needed all of our workspace. While under review, we must consider all buildings and properties that are owned by the county. Accordingly, I directed a request for a proposal to be issued seeking a full feasibility study on the county-owned facilities. As we make advancements in our people and our physical space, we're also making advancements in technology. Throughout the health crisis, we saw the success of using data-driven approach to decision-making and policy. We shall continue to expand this approach by developing a single source truth information model to combine integrated data from multiple county departments into a single unified system. The creation of this data analytic division shall be overseen by the Department of Management and Budget and will operate interdepartmentally as a review and restructure underlying data infrastructure to ensure effective and efficient delivery of services to our residents. This is accomplished through business intelligence solutions, comprehensive analysis on return on investment, ROI, and metrics-based review of high-intense, high-utilized programs. We must follow the science, we must follow the numbers, and we must strive to find the best solutions for the issues facing our community. The most effective way to be successful in this task is through our division of data analytics, consistently evaluating performance indicators while coordinating with human resources, management and budget, and the individual departments to review feedback. This division shall have a presence at our newly created Data Operation and Response Command Center located at the Shaker Tower. As we talk about breaking down barriers, one thing we noticed during the pandemic was the inequity in access to broadband internet. This was particularly of a concern regarding our school-age children. As students entered into a remote learning setting, many were without means. Access is not limited to questions of whether a provider is in your area, but must also include whether a person has the means to pay for access. Education is a fundamental right for every child in this country. If internet access is needed for a child to go to school, then we sure as heck better make sure that every student indeed has this. This is why I have called for the Albany County Connect project to perform a study of all broadband access within the county, to include both locations and access based upon that location, together with analysis of access based upon means. This study is being conducted by two industry leaders, Insight and Telson, in coordination with New York State Connect All initiative. When I took office, I said I want Albany County to be the greenest county in the state. We are on our way to accomplishing this, and now I say that we should be the greenest county in America. All of us must do our part in reducing carbon emission. Our old energy policy and commitments are no longer accepted. We must be bolder. We must push the envelope to transition early rather than later. As part of our building feasibility study, we shall look at all measures available to reduce our carbon footprint by conversion to clean and renewable energy sources. Further, we're continuing to convert our entire passenger fleet to zero-emission vehicles. My pledge this evening is for this to be completed within the next 5 years. We shall also continue with efforts to convert our medium and heavy-duty vehicles within 10 to 15 years, respectfully. We're leading by example, and over the next 3 months, we will be adding 20 new electric vehicle charging ports throughout the county to help accelerate the EV adoption in our community. We're also working with NYSERDA to make sure that our new highway garages are the greenest in New York State. The health crisis also caused an economic crisis, but this crisis did not fall upon a county that was ill prepared. Indeed, the contrary. Since the start of my administration, I have worked with the Department of Management and Budget to increase our reserves and fund balance in preparation of the unknown. Accordingly, when the crisis hit, we were ready. We took action and we implemented policies that shrunk our budget to preserve costs and avoid any need for layoff or furloughs. As part of the American Rescue Plan, the County of Albany receives $58 million. This is in 2 annual payments of $29 million. For the first installment, we used the money to stabilize the finances by replacing lost revenue. This year, we've created a task force with the legislature and fiscal representatives of the county to develop a plan for the second $29 million. The hope is that the plan and projects from these monies shall be the seeds and catalysts for other projects that continue with our overall mission of health, wellness, and quality of life to our residents as we break down barriers. As we discuss the health and wellness, one of the keys to success is having a community that offers people job and career opportunities that sustain families and provide growth potential for young and experienced workers. I'm very proud at the advancements that we have made in attracting and keeping growth industries. One of the most transformational investments that we have is Plug Power. It's coming to Vista Park, and the groundbreaking is going to happen literally any minute now. The growth of this green energy company here means up to 1,600 jobs in the next 5 years. By 2026, there'll be 2,300 jobs in Albany County, which a payroll of over $300 million. Having such a company and investment is sure to be a catalyst for many others, as well as supporting businesses and industries. These high-paying jobs will provide opportunities for many, and I look forward to our continued partnership with Plug Power. This company had the opportunity and other offers to go to a few other states. However, through our efforts, we did more than keep jobs here. We have expansion and more jobs coming. Thank you to all those involved, including Columbia Development, Kevin O'Connor, Lucas Rogers. Our region is well on the way to becoming an international recognized hub for clean energy manufacturing, including historical offshore wind investment at the Port of Albany and the Port of Queens. The commitment made by federal and state partners to bring this to our county cannot be overstated. Our team is actively working with local partners to develop workforce development and training opportunities for people in our historically disadvantaged neighborhoods to begin careers in this exciting field. Our county also has a bright future as a hub for research and development. SUNY Albany recently just cut a ribbon on the state-of-the-art E-Tech building, and I want to thank Governor Hochul for including $750 million in her executive budget to support the construction of the new Wadsworth Laboratory on the Harriman campus. Building on this positive moment, I'm calling on the governor to expand the state flagship designation to SUNY Albany. I also want to recognize Senator Schumer for fighting to advance semiconductor legislation in Washington and highlighting Albany as the preferred location for the proposed National Semiconductor Technology Center. And one more key highlight tonight. For everyone out there who has gone by Central Warehouse Building, that means everyone has asked what is happening with this eyesore. I know if you heard, we're moving forward. We prevailed in court, we vetted a qualified bidder, and we have a commitment from Redburn and Columbia Development to transform this building into something truly spectacular. This investment will be close to $100 million. Here is a preliminary rendering of the proposed project. No longer will be the first impression to visitors to the capital of the state of New York be one of blight and decay. The final piece of our already impressive skyline will be complete. This type of project and all of the great projects mentioned earlier show the commitment and ability for our region to grow. This also is done collaboratively through partnerships and a lot of work. But with this, we can do anything and everything. This economic development growth is being led by the Advanced Albany County Alliance. The first initiative was a grant program that provided up to $5,000 to local business in need due to the fiscal crisis brought on by COVID-19. Once again, thank you to Kevin O'Connor, our Director of Economic Development, Alan Goldberg, Chairman of the Alliance, Linda McFarlane from the Community Loan Fund, and Chairman Joyce, and all of those involved. One other economic development project that we partnered in is equally important. In the south end of Albany, a food desert existed. There was no establishment to buy fresh, healthy groceries. Unfortunately, this situation occurs far too often throughout America, particularly in neighborhoods that have a higher percent of low income and black and brown individuals. Here in Albany, we have people that stepped up to find solutions. Trayvon Jackson from the African American Culture Center, through a collaboration with private investors and key government officials, brought the former McDonald's site on South Pearl Street to convert into a grocery store. This will address a serious lack of options for fresh and healthy food in the neighborhood. Additionally, this location shall assist in bridging and bringing the downtown and South End communities together. Congratulations to Trayvon Jackson for his vision, and thanks to the Albany County CRC, County Legislature, MVP Healthcare, Capcom Federal Credit Union, KeyBank, Downtown Bid, and the Advanced Albany County Alliance for making this happen. We're coming out of this dark, horrible period, but we must not wallow in the pain. There was much tragedy to be sure, but from the crisis, we must learn. We must grow. We must be brave. Let us rise up. Let us break past habits. Let us form a new bond and new partnerships. Let us break down all barriers. Let us be kind. Let us be inclusive. And let Albany County show the world what can be done with good government and the best workforce. Thank you. May God bless you, and may God bless our great county of Albany and this great nation.